Hello, my name is Ashley Sanders, and I'm a licensed mental health counselor in Florida. I've been working closely with schools for over a decade to provide educational mental health supports for students, develop wellness programs for staff, and ensure that mental health providers have the tools that they need for success. In this video series, we'll be learning more about solution focused brief therapy, or SFBT, including some of the most popular techniques and how to use them. According to Insoo Kimberg, one of the founders of solution focused brief therapy, this modality is based on the respectful assumption that clients have the inner resources to construct highly individualized and uniquely effective solutions to their problems. Solution focused brief therapy, or SFBT, has been a popular choice for use in education for many years, which makes sense since it is brief, solution focused, and evidence based for many presenting concerns. And it works well with students from elementary to high school. In this video, I'm going to provide a brief overview of what SFBT is and why it works so well in providing virtual school-based support. SFBT was developed in the 1970s and the 1980s by spouses Steve DeShazer and Insoo Kimberg with their team in Milwaukee. And since then, it has continued to gain popularity with clinicians due to its evidence based nature and how applicable it is to that variety of presenting concerns. But what is SFBT? Well, as we begin exploring it, keep these key points in mind. The most obvious one, it's brief and solution focused. Treatment often lasts only 3 to 8 sessions. In fact, each session can be approached with the idea that a second session may not occur. It is evidence-based and supported by research. Multiple studies have shown its efficacy in treating a variety of presenting concerns, especially as an early intervention. It is positivity-centered, where we look for the abilities and things that a client already has that will lead to success. In essence, we look for the wins. It is results-driven. It is present and future-oriented, rather than being focused on the past. One of the most important tenets in SFBT is that it is a collaborative process where we set outcomes and clients identify what personal things they are looking for. We will talk more about using the miracle question to do this in the miracle question skills section later on. In addition, keep these things in mind when using this modality. The client is the expert. If something is working, don't fix it. In fact, do more of it. And if something doesn't work, do something else. This modality fits really well in the school system, as mentioned, since it's so brief. The strength-based, solution-focused approach means that clients can find things that work for their concerns quickly. Additionally, since many schools do not have unlimited resources or funding for mental health, the limited session model of SFBT allows schools to help more students and staff within the constraints of their budget. Some of the many benefits of SFBT include being able to talk about problems without the risk of causing the client to relive the hurt or harm, since it is so future focused. It's also a focus on how they were successful in getting through the challenging experience, rather than a focus on how experiences have impacted them. The tools for success are easily achieved for school-based clinicians, as all that is needed to be successful with SFBT are relationships, hope, and expectancy. Next, let's take a closer look at questions in SFBT. After that, we're going to introduce you to some techniques commonly used in SFBT, and we're going to learn how to utilize them with your clients. You may be surprised to see how many of these things you're already naturally using. Many SFBT practitioners say that solution-focused brief therapy is about 2 things: knowing how to ask the right question and being curious. It is a questions-based process that encourages us to embrace curiosity without being nosy. We know that when people are experiencing difficult moments, their perspective shrinks, and it is harder for them to experience or see things outside of that shrinking perspective. In SFBT, the way to address the shrinking perspective and help clients find positive emotions and solutions beyond the difficult experience is through questions. Questions act as an invitation to a client. So remember, just asking that question is powerful. A client does not have to answer the question out loud for a change in perspective to occur. In essence, clients don't dismiss or fail to answer our questions because the questions are difficult. Rather, they are in a difficult moment that has created a diminished perspective. When using SFBT with clients, we need to learn how to ask the next question, not the right question. Take these steps to help you build this skill. Don't overthink your next question. As we mentioned, be curious but not nosy. When we are curious, we focus on desired outcomes, but when we are nosy, we are focusing on everything else. Work with the client to find the outcome. Once you know the outcome, tailor questions to that outcome by inviting people into the communication process. And this last one is really tough, but don't rescue people from the question. Let them do the work. The following sections will refer to more specific skills in SFBT. As you watch these modules, you will notice that questions play a part in everything we do in SFBT. Next up, let's talk about the miracle question technique. This is perhaps one of the most well-known solution-focused brief therapy techniques. As mentioned in the introduction, SFBT focuses on collaboratively setting outcomes with the client. So the miracle question, along with some other outcome setting questions, acts as the vehicle for this tenet. Keep in mind as you discuss these questions with the client that there is a difference between a goal and an outcome. A goal is related to what one wants from therapy, and an outcome is that thing they are achieving from the goal. For example, someone may state, I want to lose 30 pounds, which is a goal. But as you dig deeper, you may find out that they want to lose that weight because they state they want to be alive and healthy for their grandkids. This is an outcome. And when you help them identify this, it can be very, very powerful. The miracle question should be used at the start of treatment. It can be done before, after, or during your brief psychosocial and can be infused with your traditional information gathering during a first session. The goal of the miracle question is to help the client consider what their life would be like without the presenting problem or concern. This allows them to consider future possibilities. Once they answer this question, it opens the doorway to identify small, practical, and manageable steps that would result in immediate change. It also allows one to start realizing that life without that specific problem is possible. To ask the miracle question, you start by setting the scene for a miracle to have occurred. That means that the presenting concern is gone. How you choose to word the miracle question is really up to you, but an example would be, imagine that while you're sleeping tonight, a miracle happened. The miracle is that the concern that brought you here is solved. However, since you were sleeping, you have no idea that that miracle happened. So when you wake up tomorrow morning, after this miracle has occurred, what's going to be your first small sign to yourself that something has changed? Along with the miracle question, you can ask some other questions that elicit information to help with understanding what outcomes a client is looking for, such as questions about best hopes. Examples of these would be, what is your best hope for what will change as a result of coming to therapy? You can also ask about their best hope for each session or the work you will do together. Best hope should be concrete and observable, so you may need to ask more questions to get there. Other questions that showcase this change could be, what will be different as a result of therapy that would make them or a loved one look back and reflect it was a good idea to come? How will you know that our time together was a good use of your time? Once you have worked with your client to really know what outcome they are hoping for and to create a detailed description of how life will look after this outcome is reached, you can start making plans by breaking things into small, achievable steps and looking for exceptions. You're going to learn more about these coming up next. Now, let's talk about exceptions and how to approach these with clients. In the words of Steve de Sager, one of the pioneers of solution-focused brief therapy, if you do not ask about exceptions and successes, the client will not tell you. After all, what they are concerned about is the problem which drove them to seeking therapy. Utilizing exceptions is an important aspect of SFBT. The questions related to exceptions are based on the idea there are times when the presenting issue or concern is not negatively impacting the individual. By helping the client notice these experiences, it gives them less power. With exceptions, we are exploring times the problem doesn't happen, happens less, happens with less intensity, or doesn't last as long. Remember, exploring and amplifying exceptions can help lead to more times a problem is not occurring. Additionally, as we look at exceptions with the client, look for instances. These are when part of the desired outcome is already occurring in a client's life. For example, if you have a student that is skipping multiple classes but is not skipping their English class, it can be very helpful to explore why that class is the exception. Is it a class they feel confident in? Is the teacher kinder or more engaging? Is the time of the class a better time for them? Do they have more friends in the class? The answers unlocked in this discussion can provide some great ideas for finding successes in attendance in other classes. Another example would be a student that feels shy and does not speak in class or to other students at school. If you're able to explore a time that they did talk more in a social setting or at school, these answers can help the client gain insight so that you can explore as a team to help find solutions for other scenarios. Some common exception questions include: can you think of a time that the problem was not present? When did you feel the happiest? What was it about that day, experience, time that made it different than normal? When is this not a concern? And what are you doing differently in that moment? When do you feel calmer, less shy, less depressed, etc.? Remember that using these questions allow you to work as a team with the client to examine their experience, gain insight, and find some solutions. Therapeutic teamwork is a huge part of SFBT, especially within the exception questions. Next, let's talk about scaling questions. This is one of my favorite techniques to use with children and teens. Scaling questions can provide a lot of helpful information. They're easily adaptable to a variety of situations, and they're just really easy to use. Every single one of the clients I work with knows that I'm going to start a session asking them what their week was on a 1 to 10 scale. And on my end, I record this weekly in my notes because the information can become so valuable when I'm looking for patterns and for progress. More importantly, I can use this information to share with the client to show them their own patterns or progress. In this module, we will be taking a look at the many ways you can use scaling questions as part of therapy sessions. First off, let's briefly discuss the purpose of scaling questions. In essence, scaling questions help a client break down their perception of an experience or situation into actual data points or grades. This can help them conceptualize something in a way that feels more controllable to them, lets them take a step back from the experience to observe it from a neutral perspective, and helps break down other options into next steps. One of the things I love about scaling questions is a lot of my clients begin to use the scale even when we're not meeting as a way to think about what experiences they're having during the week. So, as I mentioned previously, a great example of a scaling question is to just ask someone to share where their week fell on a 1 to 10 scale, with 1 being the lowest and 10 being the highest. Sometimes I have clients that want me to define what a 1 and a 10 look like. In those cases, I ask them to think about what a 1 would look like for them and what a 10 would look like for them, stressing the importance of the to them. I clarify that this is their scale and there's no wrong or right way to do it. After they give a number, I may explore what would have made it higher or lower. For some clients that seem to sit at a 5 on a weekly basis, I often ask what was the lowest their number got that week and what was happening then. I've also asked what was the highest number and what was happening in that moment. This really helps to start to clarify, define some moments in their week, and explore how they are perceiving things. It can be especially helpful to ask them what prevented them from being a lower number in order to explore some positives or coping strategies. Some other great scaling questions include ones focused on specific experiences or their presenting concern. For example, if someone is having stress at work, I may ask how stressful their work week was on a 1 to 10 scale. I then may explore with them what could have made it one number higher and create a plan to implement small steps to reach that number next week. If I have a student that has a history of self injury but is currently not engaging in cutting, I may ask them how strong the urge was this week on a 1 to 10 scale. Then we're going to explore how, even at that stated number, they were able to avoid cutting themselves. This gives us a chance to really look into coping strategies that are working for them. We can look at a client's motivation for change on a scale as well. We can explore their moods or various feelings on a scale. There are so many ways to use scaling questions and really tailor them to your client. Within the conversations about scales, we can start clients on presupposing change, which is an important part of SFBT and something that we will explore later in another module. Questions about how to get numbers moving can help with this. Things such as, what would it take to get that down to a 6 from a 7? Or, what would it look like if your week was an 8 instead of a 7? Can really help this process. For those that are more visual learners or for younger clients, keep in mind that you can also use scaling questions that are not related to numbers. For example, using a visual image of a staircase and asking them where they fall on the stairs, or asking younger students how much of something they experience, using your hands as a visual guide. To do that, I may start my hand really low and then raise it higher and higher to showcase higher numbers. In the next section, I'll turn it over to my colleague John Ebert to discuss the concept of resource talk and how it can benefit the work you do with your clients as part of a solution focused brief therapy approach.
Thank you for being here for this series on solution-focused brief therapy. My name is John Ebert, and I'm a licensed professional counselor. I've had the privilege of working with youth and families for nearly 20 years. And during that time, I've come to realize the power of identifying resources and strengths available to the client. Today, I'm here to talk to you about the solution-focused concept known as resource talk, what it is, and how it can be used in your work with students and other clients. Once the client has identified an outcome that is important to them or that would create hope within their current situation, our next tool in supporting them within a solution-focused framework deals with identifying resources that are available to help them achieve this desired outcome. These resources can be made up of both personal qualities that have helped them achieve success in the past, as well as other supports they currently have at their disposal that can assist them in moving forward. This process of assisting the client in exploring and identifying available resources is otherwise referred to as resource talk. When individuals are experiencing difficult moments, their perspective shrinks and it's harder for them to see things outside of their limited perspective. Things that could allow them to find solutions and produce a more hopeful outlook. Resource talk is a way for the therapist and client to focus on things that support the achievement of their desired outcome, rather than focusing on the problem that is limiting their ability to move forward. It's important to note that we're not talking about completing a traditional strength-based assessment here, which is more of a formal process as opposed to a personal one. Through Resource Talk, we are creating not only an awareness of what has allowed the client to be successful in the past, but also what will create opportunity for future success. Maybe even more important is that Resource Talk is where our connection with the client occurs. It's where we get to know the client rather than simply exploring personal qualities they possess. Resource Talk also helps us understand and focus on their uniqueness as an individual. In addition, it creates a more positive, strength-based focus in their mind, rather than a problem, weakness-based focus that likely led to them seeking out counseling in the first place. So as you incorporate Resource Talk with a client, consider that this is a crucial time where you establish connection and rapport with the client, getting to know not just about their strengths and supports, but more importantly about who they are as a person. Explore their uniqueness and how past and present skill sets have allowed for past and present successes. Support the client in recognizing how they know they are being successful currently and how this can be applied more broadly in their decisions and relationships. By helping clients understand the resources that exist, we help them increase their positive emotion and ultimately an increased perspective. As a part of Resource Talk with clients, consider the following questions. What do you do for fun? Why do you do it? What do these activities do for you? What specifically do you enjoy about these activities? How do you know when you're achieving success? What does success look like? What does it feel like? Who have you experienced success with in the past? Who in your life is successful in managing what you're currently experiencing? What qualities would a person possess that tells you they are a resource for you? Now that we've discussed resources and how to integrate them into sessions with clients, let's take a look at how we can support the client in initiating change through the power of just one small step, or by doing one thing differently. One of the key beliefs of solution-focused therapy is that, as a general rule, people develop default problem patterns based on their individual experiences. In addition, people also develop default solution patterns in response to the problems they face. These patterns ultimately influence how an individual interprets, experiences, and copes with problems, whether small everyday ones or major life-altering ones. In essence, our default becomes the standard we apply to everything, not because it's effective, but because it's what we've always done. With this in mind, the concept of do one thing different acknowledges several important things for the client. Number one, that change is required to produce a different result. Number two, that change is possible. And number three, that the client already possesses the strengths and resources to create change. Once the client accepts these three ideals as being true, they are in the position to determine what one thing they can do differently would be within a given situation. This one different thing is then applied to the current default solution pattern, evaluated for effectiveness, and then continued or modified based on the new outcome achieved. Let's take a moment and put this concept into practice. To begin, think of a recurring problem or issue that you face. This doesn't have to be a major thing, just something that you find yourself addressing periodically. Examples could be running out of money before the end of the month, finding that Monday mornings are difficult to manage, etc. Next, look at what the elements are that make up your specific situation. Think about what happens both before and after. Do you overindulge in things on the weekend, which impacts quality of sleep and ultimately make Monday mornings more difficult? Or maybe you find it hard to start the workday without that $5 cup of Starbucks coffee, which, by the 20th of each month, has drained your available resources, requiring you to accrue credit card debt to maintain your daily schedule. These may apply to you, or you may be thinking of your own scenario. Whichever the case, now identify the parts that you can control that are influencing the outcome in a negative way. And then do one thing differently that could make the end result more positive for you. Maybe you limit the amount of consumption or the times when you consume. Maybe you decide that this activity needs to be replaced altogether with one that is healthier or without the unpleasant side effects. And looking at the money scenario, maybe you treat yourself to a Starbucks coffee on Fridays only and make your own coffee at home during the week. Or maybe you limit eating out in order to budget for the daily Starbucks treat before work. In most situations where we face challenges, it is possible to identify several points where one thing different is within our control and that will change the result for the better. So what can you do differently in response to an outcome you're wanting to change? Consider the following as examples of questions you may incorporate into sessions in an effort to emphasize this do one thing different concept. Think about the things you do in a problem situation and identify what is within your control. These questions may include: what is within your control in this situation, and what one thing could you leverage to produce a different result? Are there responses that could make things better? Are there responses that consistently make things worse? Which one of these responses can you try or eliminate? What have you said in the past that's been beneficial when dealing with this? Is there one thing that's worked previously that you could do now? Is there someone you know that is successful in managing this issue? What are things you notice they do differently than you? How can you incorporate one new skill set into the situation that you see others benefiting from? Is there a time when this problem is harder to manage? Is there a better time to try and address this issue? Identify one thing that can be changed based on the time and place that this issue occurs for you. Now that we've explored the concept of do one thing differently, let's move on to the power of compliments and reinforcing the positive. We have all experienced the challenges of life storms. The winds and rains of struggle and hopelessness are relatable for all of us and are having an impact, especially now more than ever, in the lives of adolescents and adults. In this next module, we will focus on another technique to help us navigate the mental and emotional elements of the storm. Compliments and reinforcing the positive are crucial elements in both assisting the client in identifying and choosing hope within their current situation, as well as in redirecting them away from problem-focused thinking and toward the past and present successes that they've experienced. It's not about dismissing the negative or giving them a pair of rose-colored glasses. Rather, it's a shift in focus that doesn't ignore the challenges, but instead reinforces the positive and acknowledges what the client is doing well. When we guide the client towards solutions, we are in a way inviting them to identify what they're doing well and then build on what has worked in the past by implementing it in the present. This results in clients immediately focusing on those positive influences that have brought that change for them previously. This form of positive psychology results in a broadening or expansion of both mind and hope for the client as they focus on their desired outcome. Let's each take a minute and think back to a time that was difficult or challenging. Maybe you faced a job loss or a financial hardship or even a parenting challenge. When I think about some of the challenges our family personally experienced during the 2020 lockdowns, the negative feelings associated with those events come rushing back, even though 2 years have passed. Today, I can step away from the intense negative feelings associated with the memories of 2020 because my current reality is void of those problems. Now consider a client that is sitting with you and is currently in the middle of a personal storm. Those negative feelings might be all that they're experiencing, and the obstacles may be the only thing that they're able to see. A change in perspective and infusion of hope is often required to alter focus and allow for solution thinking to begin. Questions and statements such as, what are you learning about yourself as a result of this experience? What strengths have allowed you to get this far in dealing with the situation? Or even, have you considered how brave you are just by coming in and discussing this with me today? Are all great examples of this concept. Now consider how you would feel if you were going through a hard time and a friend or significant other or even a counselor redirected your focus in this way. Suddenly, there is hope within the situation. You are focusing on what you can do, what you have done, and the strengths that you do possess. This is a powerful shift that can be the difference in moving through the storm rather than simply existing within it. Now that we've discussed the importance of compliments and the impact they can have on a client, understanding how to best integrate these in session is the next logical step. As you begin integrating compliments into your interactions with clients and others, consider the following elements that allow for a compliment to be both believed and received. Be sincere. Stating something to a client that you don't believe or that is sarcastic will harm therapeutic rapport and likely will harm the client. It is better to say nothing than to say something you don't mean or believe. Be specific. General compliments are nice, but specific compliments will carry more weight and will help target things that are more likely to be repeated. Focus on actions. By identifying actions taken, choices made, or reactions avoided, the focus is on what the client can control. Don't qualify. It is best to offer the compliment and then move on. Adding qualifiers and caveats can distract from the compliment and muddy the message that you're trying to convey to the client. And finally, don't wait. Offer the compliment immediately or as soon as you have the ability to do so. Waiting can make it seem like you are searching for something positive to say or can come across as undermining or sincere. As we have seen in the previous modules, solution-focused brief therapy is driven by the exploration of solutions rather than problems. It focuses heavily on the resources available to the client. It looks to build a sense of hope moving forward, and it is guided by the client and the next question. Ultimately, the focus throughout the solution-focused modality emphasizes what is possible and desired in the eyes of the client, and then identifies supports, strengths, and past successes as a means of supporting the client with initiating and experiencing the change they seek. If you would like to know more about working with eTherapy, please reach out to us. eTherapy is here to solve problems and support the unique needs of your students and school. We offer direct mental health services, comprehensive assessments, as well as trainings for your entire school community. We can tailor a program to solve your pain points and fit your particular needs. So reach out to us today. We look forward to hearing from you soon.